Hi guys, and welcome to a coffee chat. I'm Dr. Boomer Brown with Doing Good at Work. Well, this week we're going to continue our discussion about anxiety. Last week I talked to you about anxiety, a little bit about an introduction, some things that you might feel if you are feeling anxious, the fact that all human beings are anxious at some point, but sometimes anxiety gets the upper hand and it becomes very oppressive and excessive in the way it manifests itself. When that happens, we want to make sure that people are able to get the kind of care that they need to be released from the grasp of anxiety. Well, anxiety, as complex as it is, can be broken down into two different areas when we talk about medical issues around anxiety. One of those is the physiological side. Your anxiety is being experienced by something that's happening inside your body. It could be a chemical imbalance, a chemical disorder that could be causing the anxiety. Or it could be something else inside the body, physiologically speaking, that is causing anxiety. The most popular way of dealing with these types of disorders is some type of drug therapy, tranquilizers, different types of things that give you a short-term relief from that anxiety. There are two things that we need to be mindful of when we choose to go this way of treating anxiety. One, these tranquilizing agents prescribed by doctors sometimes can mask the issue. They don't necessarily deal with the real issue, and they give you quick relief. Another thing is these types of drugs are very addictive, and you need to be very careful when you're using these types of medications. So sometimes it is physiological, but other times is psychological. Here again, this is dealing with how you are mentally processing something that may be external from your body. This may be a fear of spiders or of snakes. We'll talk a little bit more about that next week, these certain groups of behaviors that manifest themselves in anxiety. But in this way, you usually can find ways of dealing with this through counseling. Now, you don't necessarily, whether it's physiological or psychological, have to go the tranquilizer state. There are new types of medications that can help that are not addictive, and these are more favorable in helping someone take a combination of medical therapy or the medicines that you actually prescribed and a counseling therapy. So when you put those two things together, you have a very well-rounded approach to deal with anxiety. Well, I'm not sure where you are today. I'm not sure where a family member, someone you know, a coworker might be involved with anxiety, but helping you to understand that it's not just something you can click your fingers and it goes away. This is a very complex situation. And it could be manifesting itself in a physiological side or in a psychological side. That's why it's important to get to a mental health provider as quickly as you can and help them understand what you're experiencing so together you can work out a way to overcome the anxiousness that you or a loved one or a friend are experiencing. That's the services that we offer through Doing Good at Work for you as an employee. If you need to speak to someone, if you want to start at the lowest level and just ask for some resource that will help you with understanding your potential anxiety or other disorders, you can order those resources free. Just send us an email. If you'd like to talk to someone, remember there is a mental health first responder, a listener, a trained listener, not a trained counselor or psychologist, but someone who will listen to you and help you think through your options. If you do need a referral, we'll be happy to provide that as well. Listen, we care about you deeply, and we know that this is an anxious world. You know, recent studies have shown that 1 in 5 persons experience anxiousness over the last year. This is not something that's going away quickly. It's not something that we should deal with lightly. We really should try to address it from a good, positive way. And that's why we at Doing Good at Work are here to support you. Listen, thank you for stopping by and listening to my conversation this week. I hope you'll come back next week. I'll talk about some of the specific manifestations that we often experience when we're experiencing anxiety. Thanks again, and as always, I hope to see you next week here on A Coffee Chat.